Hi everybody, my name is OPM Masakin. I'm from New Jersey City University. I'll be going over the Responsibility6, which is serving as a health education resource person. First, we're going to define what a health resource person is. One, who has a level of competency on health issues and policy. One who knows where and how to get information and materials regarding health discrepancies, preventive care, coping methods from reliable and accountable sources. One who can serve as a guide. Okay. The role of a health education specialist. Use computerized health retrieval systems. Access databases. In terms of access database, we have access databases like SHID, which is Combined Health Information Database, CINHAL, which is Cumulative Index to Nursing and Allied Health Literature, NIH, National Institute of Health, Census.gov, which is Census Bureau Information, CDC, Center for Disease and Control and Prevention, Medline Plus, and HRSA, which is Health Resources and Services Administration. Finding information on specific diseases. Okay, there are do's and don'ts. Okay, what you do want to do is use databases like government sites, peer-reviewed research, curated premier search engines like Medline Plus. What you do not want to use is random information of random sites. You want to stick with verifiable information, which is you want to stick with addresses, IP addresses, which end in gov.edu, .org, before you go to a .com. Okay? If the information is coming from an editable source where the user can change information directly on the site, we do not want to use it. Okay? We don't want to use blogs. We do not want to use personal websites. A note on that is some personal websites can sound professional. So you can have things like health.com and goodliving.com. That doesn't necessarily mean that it is a curated site or it is a site that can be used by health professionals to give out verifiable information. Because, again, sometimes they can be manned by unqualified people. What you do not get research information from movies or documentaries. This is absolutely, please never do this. Even when the information is solid, especially on documentaries, because of the editing requirements, sometimes the information is not all there. So you have bits and pieces of it. They can be true, but it's not all there most of the time. They have a time limit on how long documentaries can be. Okay. Obtain local, regional, state, and national epidemiological data. Okay. Example is the census tract information, which is census.gov. This is an extremely reliable data tool. Okay, some data tools within the Census.gov that we as health educators can use are the American Fact Finder, which is statistics from the economic census, the American Community Survey, and the 2010, and which will be updated very soon, I think, census, among others. Okay, we also have Quick Facts. Okay. Quick Facts provides frequently requested Census Bureau information at the national, state, and county levels. We have Census Explorer, okay, which helps us make new discoveries about neighborhoods through the power of statistics with the U.S. Census Bureau's newest mapping tool. So it works something like GIS on creating maps. We also have Easy Stats, which is a quick and easy access to selected statistics collected by the U.S. Census Bureau through American Community Survey. Another type of database would be NIH database. This is reliable and it's very vast. The contents range from surveillance reports to health information lines. Okay, you can get things like printable materials, exercises available from many common health issues in the country. You could either make this information, you could either take this information how it is presented by the NIH, but when you can, you should try to further tailor it to suit the target population. We'll discuss more about that a little later. 6.1. Okay, key terms. One of the key terms is the Code of Ethics, okay, which can be found on the NCHEC website. Consultation, informal consulting, no written agreement. Formal consulting requires a contract, and evidence-based, which is program or strategies evaluated and found to be effective. 6.1. Obtain and disseminate health-related information. Access information needs. What is your target population lacking in terms of information? What do they not know, and how can you get them to know it? For example, if there's a large proportion of hypertensive individuals in the community you're serving, you might feel there's a need for an intervention to inform them on ways to prevent hypertension or ways to better manage it if they already have it. Okay? Things like lowering salt intake, diet changes, weight management, for them to quit smoking if that's a problem, and medication if it's prescribed by a health clinician. So you help them with adherence. You encourage them to take the medication and see their doctors, make sure they get to the appointments at the appropriate times. Identify valid information resources. Okay. So what we want to really think about when we're doing this is we look at the reliability. All right. We also look at the authenticity of whatever information we're getting. Questions you want to ask yourself when looking at this information is it peer reviewed? Is it approved by the proper organizations? Who is responsible for the site? What is the purpose of the site and the funding? One thing about the funding is most of the time, when whoever is funding it normally has a significant amount of control over the content of the information. So we have to watch out for that. Next is critical resources materials, critique resource materials for accuracy, relevance, and timelessness. In terms of accuracy, what is the source of the information? Does it correspond with information given by other reliable sources? So if you have a situation where a source, like a .org, has conflicting information regarding conditions regarding a condition from a government site, what should you go for? All right, you want to go for the government sites. Why? The government sites have more resources in terms of money to conduct studies that help them to their conclusions. They also have qualified individuals to make sure it's accurate. And the government is responsible to the people. They have no other interest but the people. The people are their special interest, so they give as much information as accurate as possible. Next is convey health-related information to priority populations. Effectiveness of this depends on how much the health educator understands the target population. For example, for children, the health educator might make the material easy to understand by changing the vocabulary to something more age-appropriate and the length of the text. Okay? For the elderly, the educator might want to change the size of the text and other materials to make it easier to read. Okay? It helps to be very culturally competent. It can clue the educator into what will be accepted in the community, so the information can be further tailored to that population. Conveying health-related information to priority populations. It is critical. Conveying health-related information to the stakeholders. It is critical for stakeholders to understand every aspect of the intervention. Not only will it help in retaining their support, it can also give them a chance to come to the educator with complaints or a more effective way to go about the intervention. Let's remember that some of the stakeholders know a lot about the target population, hence why they're stakeholders of it, and what will or will not carry over well. Okay. Moving on to 6.2, providing training. What we want to do is when we identify priority population, we're depending on your intervention. For example, when there is an intervention for drug use, and you have a college or high school within the scope of your program. This should become your priority population because it's just based on their susceptibility to drug use. Okay, again, you have a town, and the town has a huge population of teenage children and teenagers and children. You want to gear your information totally more to them because, again, they're way more susceptible than a full-grown adult. Okay. 6.3. Serve as a health education consultant. We want to assess needs for assistance. This is a process of finding the needs of the target population and educating on how to get that need met. Okay? If the elderly in a community needs a new wheelchair, if it's within the scope of your intervention, you can consult on how to get this need met. So you want to know how, where, and what are the requirements to get this need met. Define parameters of effective consultative relationships. Okay, make the scope of your intervention clear to the target population. Example, if you're consulted as a health counselor, you must let the client know what you're authorized to do and what you are not authorized to do. For example, you might not be able to diagnose or psychoanalyze. So at the end of the session, the client has an idea of what to expect. And before they have an idea of what to expect at the end of the session, you have to let them know in the beginning by setting, you set the standard and you set early in the session what you can do for them and the services you can provide for them should they need it. Establish consultative relationships. Recognize the target population's needs and provide solutions that are best for their lifestyle. Something that won't dramatically change the way they live or the way they do things. Okay, the reason for this is adherence. If you go to a client and you change completely what they normally do on a daily basis, chances are they're not going to be able to follow it. You want to make the change, slowly. You want to make the changes slowly, and you want to make it progressive. Okay, so for example, let's say you have a client that comes in for a weight management session, and the client's culture has carb-heavy foods and use saturated fats to add flavor. It will not be effective to tell the client to get rid of all of it. Chances are they won't and might even take offense to the suggestion. But if you give the client suggestions on how to replace some of the unhealthy components of the food to something more beneficial to their health, there will be a greater chance of adherence. Facilitate collaborative efforts to achieve program goals. What you want to do is aid in synergizing the resources like clinical contacts and counseling centers. Help foster a continuation of these relationships even after the duration of your program. Apply ethical principles in consultative relationships. Okay, this goes into the Code of Ethics. So the Code of Ethics, which can be found on the NCHEC website, describes this briefly. Okay, it's telling you basically you're responsible to your profession, you're responsible to your employers, you're responsible to the delivery of health education, in research and in evaluation, and in professional preparation. What you want to ask yourself is the consulting that you're doing, or the educating you're doing, is it up to standards, set standards by NCHEC, and does it follow the principles as a health educator? This is the conclusion of Responsibility 6, serving as a health resource person. Good luck.